Hello? Hello, team S and Z. Can you hear me? Hello, team S and Z.
Yes, sir. Sir,
Can you
can
hear
you hear
me?
us? Yes, sir. Assalamualaikum, sir.
Walaikum salam. So kindly share your screen and introduce yourself.
Sir, please give us 5 minutes.
Minahil, can you hear me? Hello, Minahil Jahangir. Hello?
Assalamualaikum, sir.
Walaikum salam. Can you hear me?
Yes, sir.
Okay. Kindly share your screen and introduce yourself.
Okay, sir. Sir, I'm Vidya Fatma from Fatma Jinnah Women University. Basically, our topic for Imagine Cup is an automated system for real-time safe social distancing and face mask detection in public areas for COVID-19 safety adherence. First of all, introduction about our project. It is basically, we have designed this automated real-time system thinking about the nowadays situation. We are going to detect the social distance between the people and as well as detect them for face masks. First of all, coming towards our team is consists of 3 members: Rida Fatma, Mumna Shabib, and Ariba Abid. Moving towards the problem statement, basically nowadays COVID is increasing day by day, so we are going to design such a system using CCTV camera that is going to monitor the public. So we are going to see if the distance. I should come show you this. These 2 images are what we are going to work on. First is we are going to measure the social distance. This, if it is less than 6 meters, it is going to show in red bounding boxes. If it is a safe social distance, then it is going to be shown in green bounding boxes. And after that, the next, yes, this. And the next, the second part of our project is detecting the face mask. So if there is no face mask, it will say no face mask in the bounding box. And if a person is wearing a face mask, it will say it is wearing a face mask. Basically, about our algorithm, we are using YOLO version 4 for our implementation. It recognizes objects much more precisely and faster than other object recognition systems. It is also a real-time recognition system and will recognize multiple objects, making a boundary box between over them. So, talking about the implementation, for our implementation, we have divided our implementation into 3 phases. First is detecting the face mask. Second is measuring the social distance and combining both of them in the final stage. Moving towards the detail, we will be using the CCTV cameras and speakers. Speakers are to be installed nearby that are going to be connected with the cameras to send voice alerts automatically to the violators and giving them a warning. After that, cost analysis and hardware is going to be used as CCTV cameras and speakers. So the cost estimated is 4,000 to 5,000. A CCTV camera cost almost about 2,000, and speakers 2,000 to 3,000. So max is 5,000 and minimum is 4,000 cost. And this was
Okay.
a short introduction.
Okay, so have you done some initial research or done some work or demo or video?
Sir, yes, we have done. We have basically implemented using Colab. We are just on the detecting face mask, training our model for face masks right now, as I showed the image that we are going to work on. And I have a video basically that we trained our model on. So, just 1 minute. This is what our first implementation phase looks like. We have basically designed it for the universities. It basically will work for universities, small organization. We are able to detect.
Basically, what we are asking is, do you have your own working model or your own video or any kind of demonstration? वो तो हमने देख लिया कि वो तो कोई मतलब this is not the video made by you, something that you made on your own.
Ma'am, we trained using this model, and this is the output that we achieved right now. Just the work we have achieved right now is this image shows that the how we have trained our model on the data set.
Okay.
So up till now, basically, this is just an idea, right? And you wrote some algorithm.
Yes, and we have trained our model just using a data set.
Okay, and that data set, from where you got that?
Sir Kaggle.
Okay. And you haven't tested on the real live cam coverage, right?
Yes, sir, not yet.
Okay. And when you guys are going to do that? I mean, how much time it will take?
Yes, sir, we are working on it right now. We have trained our model, now we are working on testing.
Okay. Okay, thank you.
Okay, sir.
Thank you, team. So we move on our next team, team S and Z. Can you hear me?
Yes, sir. Can you hear us?
Yes. So kindly share your screen and introduce yourself.
Okay, sir. Okay, sir. Sir, are the slides visible?
Yes.
So I'm Saina Bazar.
And I'm Sabah Mohsen.
And we are Team SNC. Our project is basically based on smart chronic disease, AI-based smart chronic disease management system under the supervision of Mr. Adil Munawar, and we are from Lahore Garrison University.
We are here providing a platform that is AI-based smart system that will detect disease and predict efficiently with the help of systems provided. Our system will communicate with patients and deal with their problems. Here are with some problem statement that are mentioned in this slide. Chronic disease is a major health issue. Human error can lead to false diagnostic and delay in reports. Patients don't have with doctors to assess. Patients can afford expensive of treatment. Our system will take symptoms and can detect disease and provide suggestions and recommendations. We are going to take input disease as
basically we're using AI-based smart efficiently detect the disease and provide assistance to our patients. As we know that AI already has exponentially increased in recent years in terms of analysis and relationships of their patients and signs and symptoms. And artificial has already worked on huge technologies, and AI have various domains to resolve complex issues. So basically, we're using AI-based platform
smart system
for our project, and
more of our system will provide the list of doctors according to their disease so that they can easily assess them and fix their appointments with the doctor they can easily approach. If some of them have knowledge about the relevant doctors, they might not able to afford high fees of doctors. In our system, we will providing the list of relevant doctors and doctors with low treatment fees to provide the ease of patients. System purpose is to provide ease to those who cannot afford highly paid doctors treatment.
As you know that health costs are rising, so we are here with a platform that will facilitate them with the cost as well. We will provide them the doctor with less or low amount fees, and moreover, with care quality and access to convenient care it is also necessary for a patient. So patients should be able to access their health care whenever they want. This will show them a path so that they can connect to the related doctor, as well as they can also have recommendations related to their disease, get a diet plan, exercise, and moreover chronic diseases. So moreover chronic versus. So we're highly motivated to help patients looking for assistance. And our aim is to assist chronic disease patients, provide them ease to able to afford expensive, and provide them a path so they can access their doctors, fix their appointments, and provide recommendations according to their disease. When they will know about the disease, they will show them a path. How can they access their doctor and which doctor is relevant for them? And the tools we are using Python, Anaconda, PyCharm, and Django framework.
Thank you, sir.
Thank you, sir.
Sir, can you hear us?
So yes, we can. So do you have any demo or like video, or it's just
Sir,
at the
basically,
idea stage?
Sir, basically, we are collecting the doctor's data. As I told
That's
you,
in progress.
As I told you that we are providing them the platform that they can access doctors. So we are in that stage that we are collecting data of doctors, and then we will try them to make them access to patients as well, and try to fix their appointments. So we are doing it step by step.
Okay, so no visual work yet, right?
Sorry, sir.
I mean कि अभी तक आपने कुछ नहीं बनाया जो हम देख सकें, स्क्रीनशॉट्स और कोई डेमो और कोई इस तरह की चीज.
सर अभी तो हम कलेक्शन स्टेज पे हैं, तो हम डेटा कलेक्ट कर रहे हैं, तो हम उसको भी मतलब एप्लीकेशन में लेकर आएंगे.
So starting modules complete हैं, but they are not inform that it is compulsory to show there.
Okay, so you're in 7th semester, I believe.
Yes, ma'am.
Yes, ma'am.
ऑल राइट. और आपने उन्हें कनेक्ट किस तरीके से करने का प्लान किया हुआ है डॉक्टर्स को पेशेंट के साथ? यू आर गोइंग टू मेक अ वेब पोर्टल और अ डैशबोर्ड?
हॉस्पिटल विजिट्स करेंगे. सॉरी मैम.
मैम क्या कह रही हैं आप?
मैं कह रही हूँ कि आपने उनको कनेक्ट किस तरह करवाना है, लाइक डॉक्टर को पेशेंट के साथ? कोई आप प्लेटफॉर्म बिल्ड करेंगे, एप्लीकेशन बनाएंगे, मोबाइल ऐप और वेब पोर्टल?
जी हमारे बेसिकली वेब डेवलपमेंट, ये वेब जो है डेस्कटॉप है हमारी,
Django एप्लीकेशन,
Django फ्रेमवर्क हम यूज कर रहे हैं PyCharm पे.
ठीक,
तो इसके थ्रू हम उनको जी इस एप्लीकेशन में लेकर आएंगे उनके डॉक्टर्स की इन्फॉर्मेशन को.
ऑल राइट, थैंक यू वेरी मच.
एंड वी कैन आल्सो फिक्स देयर अपॉइंटमेंट्स अकॉर्डिंगली.
ठीक है, थैंक यू.
थैंक यू मैम. अल्लाह हाफिज.
Thank you, team. So we move on our next team. Mariam Khan Afridi. Can you hear me?
Yes, sir, I can hear you.
Hello.
Hello.
आपको मेरी आवाज आ रही है?
जी सर, आ रही है.
ठीक है, आप स्क्रीन शेयर करें और स्टार्ट करें.
ओके सर. Yes, sir. Is it visible?
Yes.
Yes, sir. So I'm Mariam Khan Afridi from Team Smart WDB, and our topic is Smart Wireless Doorbell with Image Capturing Service and Temperature Sensor. So,
Kindly mention your university.
yes, sir. We are from Fatima Jinnah Women University.
रिप्रेजेंट कर रही है मैं कह रही हूँ उन्होंने अभी एंटर किया है हम दोनों को ना तो अब मरियम हाँ ठीक है तुम करो जल्दी
Sir, our project is focusing on the home security as well as maintaining social distancing while this pandemic, and it is beneficial for the home security. As we know, there are many projects like which are made for home security, like CCTV cameras and many other gadgets, but we are integrating all this together in one package where we are giving the option to ring the doorbell wirelessly. The visitor will not have to touch the doorbell, and he will just stand near the doorbell, and it will detect the motion of the person's hand, and then will ring the bell wirelessly. And then it will also detect the temperature of the visitor, and it will also capture the image of the visitor. And the additional thing we are putting into it is the application that the Android application will control all this system, and all this information will be sent to the application, and then the owner will decide if he wants to receive the visitor or not, and he will also get to know the temperature of the visitor. The visitor will also get to notify about his temperature by displaying a screen near the doorbell. So it will be very beneficial in these pandemic days as well as afterwards. Then these are the functionalities that bell will ring wirelessly. We doesn't have to touch it, and it will detect the temperature. It will also capture the image of the visitor, and all this
Excuse me?
information will be sent to the application. Yes, ma'am.
We have understood the concept and the idea. Do you have any working
Yes.
model or any demonstration?
We have not made a model yet. We have worked on the research work, like we have made the SRS and design document, and now we will start the implementation.
Okay, so do you have any, so you don't have any prototype or I can say a beta version of your application at the moment?
No, not yet.
अच्छा आपने कोई UI डिजाइनिंग वगैरह भी नहीं की एप्लीकेशन की?
नहीं.
अच्छा ठीक है चलें थैंक यू सो मच
Thank you so much.
Thank you, team. So you may leave now. So we move on our next team. Adina Batul, can you hear me?
Yes, sir, I can hear you.
Okay, kindly share your screen and introduce yourself.
Okay.
Assalamualaikum.
जी वालेकुम अस्सलाम
You have joined the conference.
Sir, so our team's name is Genesis, and we are from Fatima Jinnah Women University.
टेन्योर ट्रैक सिस्टम 2003 में हमने बनाया था HEC ने। उसका मकसद
You
ये
have
था
joined the
कि हम
conference.
प्रोफेसर्स